Hi everyone, welcome to the Oncodea YouTube channel. I'm Denkyu Pham and co-founder of Oncodea. Today is July 19th, 2024. We are kicking up an exciting new series aimed at engaging and inspiring the public about the work that we do in cancer screening research. And we want to show you how fascinating and impactful this field can be. And so today, with this initiative, I have the privilege of interviewing our Chief Medical Advisor, Dr. Thomas Slavin. Dr. Slavin's wealth of knowledge and passion for early cancer detection is truly inspiring. And so we're excited to share his insights with you today. Welcome, Dr. Slavin.
Yeah, thank you for having me on, Dan. Yeah, appreciate it. And loved working with you last year.
Can you start by telling us a bit about your journey, what inspired you to pursue the career in medicine and cancer research, and ultimately join Oncodea?
Yeah, so I've always just been really a proponent of keeping people safe using their genetic information, so in some capacity. So really what drove me in medical school, I always gravitated towards preventative health, cancer care, thinking about, how can we use technology and some of the great things that we're finding, in oncology and the whole diagnostic field, and how can we use that information to keep people safe, essentially. So I really started out as a hereditary cancer geneticist. I'm a medical geneticist, and I'm also have a molecular board as well, which means I could, help with lab directing and things like that. But I've really used that knowledge over the years to, see and treat patients with genetic predisposition. So people that are at risk for having for developing cancers, or maybe just developed a cancer but could be at risk for other cancers, or their family members might be at risk. And managing those folks, trying to figure out what caused their cancer in the first place. I mean, maybe it was just bad luck, but maybe they actually had a gene mutation that was inherited from many generations back, that's been disrupting and causing cancer throughout their family lines, and they're at extremely high risk, or other family members of theirs are extremely high risk of cancer. And then I've also, done a lot of work, again, in the cancer space, just around cancer diagnostics, treatment selections, liquid biopsy, thinking about, once someone develops cancer, can you track that in their blood, or, with imaging, to try to keep them not only cancer free of recurrence, but if a recurrence does come back, how can you catch it really quickly? And, I've just naturally, I think, this whole conversation has led to the fact that I would have a natural predilection towards early cancer detection. So with all the work that I've done. So I've really watched the field grow over the last, decade and a half or so. I mean, I remember distinctly, seeing a patient case study of a woman. This must have been in like probably, around 2014 or 2015, where non-invasive prenatal testing was coming out at the time for looking for conditions like Down syndrome, or trisomy 18 or trisomy 13 from a woman's blood, trying to see if there was fetal elements, essentially, that are floating around in a woman's blood that could signal that there might be one of these conditions in the child. And there were some early reports at that time that some of the signals looked really abnormal and didn't look like people had trisomy, a fetus with trisomy 21 or 18 or 13. It looked like there was something else going on, because the whole genome was essentially disrupted. And in a few of those cases, they actually found out that the woman had cancer. So that was kind of like the first, step in the field of, wow, you can actually find that cancer is essentially floating around in somebody's blood by looking at their, circulating biomarkers, essentially. And in this case, it was circulating tumor DNA. So, I've just been really excited. As you know, I came to the Oncodea team because I was just so excited on what Oncodea is doing, and the way that you're thinking about looking at cancer early detection and, tracking disease once it starts.
Can you explain what cancer screening is and why it's so important?
Yeah, so cancer screening takes many different forms. the U.S. Preventive Task Force has many, recommendations for cancer screening, as well as many other guideline bodies like the National Comprehensive Cancer Network, I should say, even though I was a former member of that. And so many know that as the NCCN. But yes, there's very good screening guidelines out there. I used to sit on the NCCN committee for colorectal cancer screening, and as part of that, we would really weigh in on essentially how to screen people, for instance, for colorectal cancer. So when to start colonoscopies, is a big reason why, with the increase in early onset colorectal cancer and obesity, the recent recommendations have been moved from starting colonoscopies at the age of 50 down to 45. So I was somewhat behind some of that, and at least helping the committee review some of that information. So I've always been a big, behind the scenes person through some of this cancer screening efforts. But there's, cancer screening is just incredibly important. I mean, cancer, if caught early, depending on the cancer, you're talking sometimes 80, 90+% 5-year survival, because if you catch it before it metastasizes throughout your body, meaning spreads throughout your body, you have a very good chance of treating most cancers. So screening is just crucial to finding those people. So, really, I would say there's two main components. There's a risk stratification component. So what is your risk? Are you at average population risk of getting cancer? Are you at below average risk? Are you at very high risk? Like, is there some horrible gene that's running through your family that's mutated, that's essentially causing people in your family to get cancer much earlier, or at a much higher rate? So those are the kind of things that go into the risk stratification side. So for that, it's making sure that if you're a patient, working with your doctors and providers to make sure that you're appropriately risk stratified. They know if there's massive amounts of cancer or other things in your family that you could be at high risk of. Same things for cardiovascular disease, but we're kind of focused on cancer during this talk. And then taking that information and developing a plan with your provider, and that plan may be average U.S. Screening guidelines, like getting your pap smears, getting your colonoscopies, getting your mammograms, but it could be that you need higher risk screening in certain elements.
And as Oncodea is at the forefront of technology-driven solutions, how do these advancements help in the early detection of cancer?
Yeah, so the sooner we can detect it, the better, in the sense that it's smaller and can ideally be acted on quicker to remove it as a whole. There's some cancers that essentially you can even just treat with some local treatment, like radiation, or even potentially chemotherapy, and you might not even need surgery. There's other cancers, as they get more advanced, yeah, you need surgery. So, and then some element of some other treatment often. So identifying the sooner we can identify cancer, the better. In some instances now, we're getting so sophisticated with our technology, we can even start identifying cancer potentially before you can even see it on imaging. So this makes it, it's kind of a interesting time to be working in the field, because there's a lot of dilemmas, and how to follow patients if they can't see it on imaging, or maybe you're not 100% sure they actually have a cancer. So it's there's a lot of screening guidelines that are going to have to come up around some of the early cancer detection technologies. For those that don't know, Oncodea has developed a platform that is really focused on a blood-based biomarker way to look at if there's cancer floating around in someone's blood. It's using, it's not just focused on DNA or RNA or methylation like some of the other technology. It really just looks at everything floating around using a very unique methodology. And I think ultimately, and one of the reasons I was so interested in joining the team is because, I see it as that's the approach you want to take. I mean, why limit yourself to a approach that just looks at DNA or RNA if you can really look at a more multi-omic approach? So that's where I've been pretty excited about it. And again, it's really, this is really specific to early cancer detection. Some of the, like, once someone has cancer, could work quite well to look at one approach, like DNA, for instance, and grinding up the tumor and looking for specific mutations. But looking for needles in the haystack, particularly on the early cancer detection front, is the more technology, the better, I say, and the more ways we can look at it and try to clarify if someone's actually positive or negative, the better.
And to wrap up this fascinating conversation, Dr. Slavin, what message would you like to share with our viewers, especially the younger generation watching this? How can they get involved and make a difference in the field of cancer research?
Yeah, absolutely. There's just so much going on. There are just more than enough things to study right now in the world of cancer. So, on average, 40 or 50% of people, unfortunately, will pass away from something related to cancer. It is, very, sad condition. Almost everyone probably watching this knows someone that's died from cancer related condition. So it is, one of those top health conditions as we think about it. We have a population that we've been fortunate that we are living longer. And one of the downsides of living longer essentially is that your cells replicate more often. And those replications sometimes lead to cell slippage and things that can just produce cancer cells. There's just so many exciting aspects of everything that we're studying. Just to point out one, thinking about immunotherapies and the way we even think about the immune system, really squashing, small developments of cancer has just really blossomed over the last 10 to 20 years. So there's something out there for everyone, whether you're an immunologist at heart or a geneticist at heart or a cancer treating oncologist at heart. There's many different ways, and it really does take a village to think about all the unique aspects of the cancer journey. So, here we've been largely talking about early cancer detection, but as I mentioned, there's a whole scope really from A to Z of, not only early cancer detection, risk stratification, screening, to diagnosis, selecting the right treatments for the right person at the right time, to then when someone is treated, to actually follow them and make sure the cancer doesn't come back, having them in some sort of survivorship clinic atmosphere, and then starting the cycle again, essentially with the next person. So there's a lot out there that is right to get studied, right right to work in, whether it's industry or academics. I think it really does take, again, I know I said it in the past, but it really does take a village to study and make a dent in cancer care.
Mhm. And thank you so much, Dr. Slavin, for sharing your insights and
Yeah, thank you, Dan.
passion with us today. It's truly inspiring to hear about the work that you're doing and the impact it's having.
Yeah, well, you're part of it. So thank you for having me on.
And thank you for all our viewers for tuning in. If you have any questions or want to learn more about our work, please leave a comment below or visit our website. And together we can make a difference in the fight against cancer. And until next time, stay curious, keep striving for a healthier future. Thank you.